Some doctors are now performing a version of a facelift to help patients suffering from debilitating headaches. Health and Science reporter Carolyn Johnson joins us. And Carolyn, some patients report relief, but plenty of skeptics here.
Well, Cheryl, this procedure is based on a brow lift, and some plastic surgeons are now using it not for cosmetic purposes, but to treat migraines. For Marianne Neese, just playing outside with her grandchildren carried the risk of triggering a migraine with crippling pain.
So bad that I was vomiting, had to go home, and the light hurt my eyes. Hi.
But after decades of seeing neurologists for her migraines, Marianne decided to turn to a plastic surgeon instead, pinning her hopes on a procedure that originally evolved from a common type of facelift.
And we're not really particularly sure why it works, we just know it does work.
Dr. Thomas McNamara began by freezing so-called trigger points around Marianne's eyes and temple with Botox to test the effect. Marianne reported temporary relief, making her a candidate for the surgery.
And at that point, we decided that the migraines were starting from the area between her eyes. Can you move that screen so I can see it?
The procedure he would ultimately perform uses techniques similar to an endoscopic brow lift. The brow lift, seen in this animation created by the American Society of Plastic Surgeons, involves severing muscles and raising the eyebrows. But instead of changing Marianne's look, Dr. McNamara says the migraine surgery is designed to relieve muscle pressure on nerves thought to trigger headaches.
And if we can decrease the amount of irritation to that nerve, we're thinking that we can decrease the amount of migraines that the patient can have.
Just weeks after the surgery, Marianne says her migraines became less frequent.
I was having 12 to 15 a month. Now if I have three or four is the most I've had.
Still, some experts are skeptical about the technique, pointing out similar surgical strategies have shown limited success.
I think I've seen a number of patients over the years that have had these cosmetic procedures at the front and at the sides and at the back. And in general terms, in the long term, I don't think they make a difference.
Neurologist Peter Goadsby directs the Headache Center at UCSF. He says many migraine patients, particularly women, experience relief in late middle age. Marianne is 63.
Well, the natural history of migraine is for things to get worse up until the 40s or 50s and then to go away and get better at any rate, particularly because of the menopause.
Still, supporters point to this recent study published in the Journal of Plastic and Reconstructive Surgery, in which 8 out of 10 patients in the trial reported relief.
Well, I think it continues to evolve. What you'll find, I think, is that there's going to be more surgeries involved in these types of treatment modalities.
At minimum, Marianne says the early result has given her the time with her grandchildren she hasn't been able to enjoy in years.
It was great. It was great to be down there without a migraine.
Now, the procedure ranges from about $3,000 to $10,000. In most cases right now, it is not covered by insurance. Dan and Cheryl.